Hello, everyone, and welcome to another episode of the Cycle Podcast. Today, I have Erika with me, and she is from Canada, and we are going to hear about her journey. And with that being said, Erika, why don't you start off by just telling us a little bit about yourself? It doesn't have to be endo related, just anything and everything you want to share.
Sure. What do I say? I always think I have like a boring life until I actually start talking about it.
Can't wait to hear.
So I'm 25, almost 26, although I look like 18. And
That's a good thing.
right? I'm gonna take it while I can, right? But I am a recent graduate of Wilfrid Laurier University. So that's here in Ontario, Canada. It's in Kitchener or Waterloo, which is not too far from Toronto. And I actually have a history degree, but I am an actress. So yeah, I did it a lot when I was in high school. Really liked it, and then quit out of fear and all that fun stuff. And after I ended up graduating university, I was like, you know what? Why did I quit?
That's awesome.
Back at it, going well. And honestly, like having endo and doing this, I've actually found that having the endo drives me even more to like succeed in this business. Everyone obviously has their reasons and their wants and their dreams and stuff like that. One of mine that actually ends up going hand in hand with this is, I'm not kind of just doing it because it's something I love to do. For me, it's also a platform. You know what I mean? Like it's a way to maybe get more attention for things that need more attention. Kind of,
100. I love that. This is kind of a sidebar, but just curious, are you active on TikTok?
A little bit, yeah. During quarantine, I decided to start doing that on and off. I have a few. I haven't done one in like a week, so I haven't been feeling great, but
I feel like that is just for actors and for endo, it's the next like platform I feel like we're going to be able to build awareness on. That's what I hope, at least.
Yeah. But yeah, that's like part of one of the things that I love about it now that I'm kind of back at it. Like I'm not, famous or anything like that by any means, but I think that if I ever do kind of get to that level, which I think if you're in, any kind of entertainment business, that is kind of the goal, just because that's where a lot of like all the jobs are and stuff. It just happens to come with the recognition, which is, I think, good and bad. Bad because you want your privacy, good because you can kind of use the platform, right? And at the risk of sounding like a geek, I always end up quoting like Uncle Ben from Spider-Man and be like, with great power comes great responsibility.
It's true.
I will live by that.
I could change my virtual background to Spider-Man right now. So my day job, I work for a movie theater chain, so.
Oh, really? Okay. So that's cool. Yeah. So, all the movies.
I know all the movies. That's great. That's, I feel like that's very noble of you to even just think that way. You're totally thinking, most people that probably want to be an actor or actress are like, I want to make it, I want to be famous, which I'm sure you kind of have that a little bit, but you want to be able to do that so you can have more reach and advocacy. It's really, really noble.
Yeah. I mean, to be honest, the being famous part of it was one of the things that scared me away from it when I was younger. I think everyone likes either attention or no attention to some degree. That's just part of human nature. But now that I've kind of lived through so many of the things that I've lived through and kind of gained confidence from a lot of it in some ways, I ended up going into like a rage like 9 months ago or something like that, and said, you know what, screw it, I'm going on Instagram, I'm going to start posting about this and not hiding it or anything like that anymore. So that's actually helped a lot for me, like personally as well as with my work, since I started doing that. I find that if I need to like pull forward emotion or something like that for a role, I actually can do it a lot easier. So in a way it's good for my work, but it's also therapeutic for me. So there's lots of, pros and cons and stuff like that. But the rage that I'm talking about, one of my friends has endo, and her gynecologist, like her whole thing, she's technically not even officially diagnosed yet because her gynecologist said, oh yeah, it sounds like you probably have this, and gave her a total verbal diagnosis. And is refusing to do surgery, to actually go in and look. And when I heard that, and she's had an even crazier journey than me in some ways, and like I lost it. I like went into a rage. I was like, no, enough is enough. It's bad enough that I went through all this kind of stuff, but to now hear about my friend and you know, kids, which is even worse.
That's why I do this podcast, because I suffered for so long, and I started talking to people like you that are much younger than me. I'm 40, and I know this baby face doesn't look 40, but, but I was so frustrated that people were being told the same thing I was 20 years ago. And I was like, I have to do something. Like, I can't live with myself if I don't do something.
Well, it's absolutely insane because, I've talked to people of all ages. Now, I actually worked at a museum for the first part of last summer, right after I graduated. And it's a women's run museum. So here in Canada, I know it's a very popular thing in the UK, but it's called the, Federated Women's Institute of Canada. And like the Women's Institute here in Stoney Creek, which is near Hamilton, which is near Toronto, and they own a little museum. It's a house, and that's actually where the Federated Women's Institute was started. And so I worked there, and I did tours and stuff like that. And because a lot of what we talked about were, you know, to do with the woman and the family who started this institute in that house, stuff came up. People would ask me questions, and I'm fairly honest with them. And so I have said, you know, oh, this is endometriosis, and it's a woman's issue that I would talk about and stuff like that. And some people knew what it was. And so I've actually talked to a woman who's like in her 70s, who's had it her whole life. And when I told her what they were telling me and what they were doing for me, she was like, that's the exact same stuff I heard and the exact same reaction I heard over 40 years ago. And her two little granddaughters that were with her, who are right at the age where they're going to be starting their period and getting into the grades where they should be talking about that stuff, wouldn't you know, they have never heard of it. It's still not mentioned in the curriculum, and that drives me up the wall. Like, just
I know absolutely. Well, how did you let's start your journey. Tell me about your story. So when did you start your period, and did you have pain right from the beginning?
So I was 11. I think my birthday is in May, so in a couple of weeks. And
happy almost birthday.
Thank you. And I can't remember though if it was before my birthday or after my birthday, but anyway, I was around 11. And it was actually at my friend's house when it happened, sleepovers. And right off the bat, pretty much, I don't think I really realized it until I started like looking back at it. But yeah, I started getting, you know, I think probably normal cramps-ish, but they became more severe pretty quickly. And all of a sudden, I started getting like really bad abdominal cramping, and it wasn't always correlated with my period. It was just really, really bad. So we, for a very long time, thought I had a whole bunch of like sensitivity issues. I had a really small stomach. My parents were wondering about an ulcer or something like that. And that was going on for a really, really long time. And then,
was that like middle school or high school, or, you know?
Yeah, so it went all the way from grade school and started getting worse in high school. I would have like these random bouts of pain where I'd actually be like doubled over. I remember once, I'm pretty sure I was in grade school. I don't know where we were going, but we were in the car going somewhere, and I just like doubled over, and it hurt. And so like I wasn't even doing anything strenuous or weird, but I was literally sitting in my car,
right,
and my parents were driving somewhere. I forget if my brother was there, and it hurt. So even from like that young age, I'd gone to the doctor. I've gone to like the emergency room a bunch of times. That is one perk about being in Canada. I can go in and out of the emergency room pretty much when I need.
Yeah. And was this pain then like every day, random? I mean, did you have it with your period? And then when you were on your period, you missed like, all right, I'm missing school, I'm missing events.
Random. So I didn't miss much school when I was younger. I've had some other things happen in my life that aren't like I don't want to turn your podcast into a giant trigger warning or anything like that, but I have a history of sexual abuse as well. So there's a little bit of that like from when I was a kid. And so I guess sort of in the same fashion that I've kind of done with the endometriosis now, I sort of took that and ran with it. It turned me into a tough little bugger. And so even when it comes to like physical pain, I brush it off quite a bit, even if it's really, really bad. Yeah. So I was the kid that unless I actually genuinely felt sick or something like that, I didn't miss a lot of school when I was in grade school from what I can remember, unless I was actually sick. If I didn't feel good, I would go to the bathroom, right? And just be like, ow.
Right, you just pushed through it.
Yeah.
Did you find like a system that worked for you? Like for me, Advil, like I just got on this Advil or Motrin regimen so I could go to school.
When I was younger, so I didn't, and I don't remember if it was my mom that just didn't want me to take a lot of Advil, Tylenol, or if it was a choice I made. I have a feeling it was probably my mom. But no, I didn't really take a lot. I ended up just doing it out of like dealing with it totally like au naturel, I guess, for a while.
Yeah.
We'll get into as I got older, and I guess later that became a bit of a problem. But
yeah.
But yeah, like when I was in high school, I remember my mom actually making a comment. So as I got, into being a teenager, obviously it did get worse.
Yes.
And on top of all the normal stuff that comes with being a teenager and mood swings and all that, and my mom actually made a comment. I remember saying something about how when I started high school, I was sick a lot more. And we kind of just chalked it up to bigger school, more people, more germs. Sure. I remember at one point she actually said something about, oh, maybe you should stop hanging out with a couple of my friends because they were sick a lot. They had pretty low immunity. She was like, maybe you should stop hanging out with them as much. You'll be sick less. And I was like, no.
You're like, nope, I'm not doing that, Mom. Sorry.
Yeah, but I didn't actually hear the word endometriosis until I was 21. Not in context of me. I think I have heard it before because I knew the word. I was familiar with the word when it was uttered to me.
Yeah.
But the first thing out of my mouth when a doctor or surgeon mentioned it to me was, does that mean I can't have kids? And that's all I knew about it. That's what I associated the word with. I don't even know where the heck I would have heard it because I know sure as hell it wasn't school.
No. Well, did the pain lead you down to finally finding an OB? I mean, how did you end up getting to that appointment?
So it was actually an emergency surgery to remove my appendix.
Okay.
With all the endo and stuff, I guess kind of a short version backtrack, but after high school, when I first started school, going to college, I ended up all over the place. I started getting severely ill, bad pain, infections, viruses up the wazoo. Like it was nuts, antibiotics all over the place. And I ended up dropping out of college, partially because I was like, you know what, I hate my program. I don't know what to do. But also because I was so ill all the time. And so I ended up.
What were you thinking at that point? Were you like, something's wrong with me? Did in your gut, were you like, I know something's wrong, but I don't want to deal with it, or nobody can figure it out?
Nobody could figure it out. The amount of times I went to the walk-in clinics, the school health people, the emergency room was absurd. People, like my parents at that point, actually started saying, you're a hypochondriac. Not that they don't love me and want to support me.
No, but
that was their conclusion.
Right, because nobody can find anything. I mean, what were your symptoms? So if people are listening and they're just starting their journey and they're 18, 19, 20, 13, like what were things that you were dealing with at that time?
Abdominal pain was by far the worst one. As I've gotten older, I've had decreased immunity as well. So that's something that obviously is still, like, I'm sick right now. I've been sick for a month as far as I know.
Like
corona.
Right. Like you just feel like you catch everything.
Everything.
Yeah.
And
so with the cramping, was it cramps 24/7, 7 days a week?
More or less, there's pretty much always a dull ache. And it ramps up. I get like these really weird contractions that literally feel like someone has reached up into my colon, grabbed it, and yanked it out. And I can feel that like in the front as well. So it's like someone went like, ooh, look, colon uterus combo, and like yanked it out.
And what about like lower back pain? Did you have that too?
I have some back pain, but that's very difficult for me to place because I also have some mild scoliosis.
Sure.
So it's like kind of hard to tell, okay, well, what's this and what's that? And am I just laying down too much? But
so you leave college because you've just been so sick. What
Yeah.
happens next?
I started doing a bunch of different tests and doctor visits when I went home, and I also decided to kind of reevaluate what I wanted to do for school. I did know I want to go back.
Yeah.
And I ended up deciding, okay, I'm going to work my butt off and get into university. So I did that from home, and like got into university from home over the next year. And I had some other tests. I had my first colonoscopy. And so I was either 19 or 20 when I had my first colonoscopy because I was also experiencing some very odd bleeding. And so the doctors at that point told me I probably had IBS.
Of course they did.
Right? That seems to be the common thing. Oh, we don't know what this is, so you have IBS. And
I think we should make like a sign for that dude with sign on Instagram. He's like famous. I'm going to reach out to him and be like, IBS is endometriosis if you're a female. Like, or I mean, I guess not a female, could go anyway. A person with a uterus. If you were
born with a uterus.
Yes.
That's what I normally say.
And you were diagnosed with IBS, like 90% chance you have endo.
Yep. Pretty much. Unless you're my dad. But like,
Right.
And my dad has celiac disease, so we were going all types of different ways with this, right? They pretty much were looking at absolutely everything else, including even cancer at one point.
Sure.
And like very briefly, it didn't go on very long, but it was discussed. And there's a bit of a history of cancer and stuff in my family, so we did have to go that route a little bit, like with colon cancer, especially because of the blood. But
how are you handling this emotionally as a 19-year-old? Like, are you just going through the motions, or you just did it? You're just pressing through?
I just did it, I think. I think it had more of a toll on me that I'm more realizing now than at the time. And like thinking about it now that I've lived it, I can see where I started to kind of derail, I guess. I would push through it, and I think it had a lot more to do with the whole, what am I going to do with my life kind of debate that was going on inside of my head, a lot more than I really knew about at the time.
Sure.
Because you don't normally think about that, right? It wasn't until, I graduated university or getting close to graduating university recently that I really put that together.
Yeah.
Because by the time I finished at Laurier, I had issues with painkillers. I skipped a lot of school because of the issues with the painkillers and absolute nausea. It like amplifies all your symptoms. I cannot recommend enough to how much you just should not take narcotics.
No, that's good. I mean, I haven't talked to anybody that has taken narcotics and potentially, got heavily into them. I'd like to talk about that if you're willing to talk about it.
Yeah, definitely. It's a big thing.
Part of your journey. So we'll go back. You get diagnosed with IBS. Let's start there. Like, what happens after that? Do you get like Nexium or something and you're like, okay, I guess, or did you know in your gut, like, this guy's wrong?
So no, I blindly still believed doctors at that point. And I know that, I try to say that they're human and I try not to like blame the heck out of them 24/7 or anything like that, but it's also very, very hard not to, because it's also their jobs to know what's going on.
Yeah.
In my opinion, if you have a patient of any age who was born with a uterus and still has it coming in, or actually not even still has it, if they were born with the uterus, if they're coming in and saying, hi, I have severe abdominal cramping, should endo not be one of the first bloody things on your list?
Yeah. For real. Yes, I agree.
But so I had already started getting prescriptions for, what was it? I think it was Percocets. So that's oxycodone or codone, I don't know, oxy mixed with Tylenol, acetaminophen, right? And it was really hard on my stomach. They'd make me throw up a lot if I didn't eat enough with them. But I didn't really take them that much then. But otherwise, honestly, I went the diet and exercise route for a little bit.
Okay.
Because with my dad having celiac disease, which I do not have it, I've been tested. But with him having that, he also, I think, has IBS or IBD, I'm not sure. But he was following something called the FODMAP diet, I think is what it's called.
Yes.
Oh, I did it too. Lo and behold, it had little to no effect on anything, right? Because that wasn't the issue.
Sure.
It helps a bit, with inflammation, but
yeah.
You
didn't notice a significant enough difference to be like, this is it.
Yeah, exactly.
Yeah.
So yeah, I went into Laurier thinking I had IBS, and within my first year at Laurier, so I was just living like that. I even went gluten-free while I was at school because I was still toying with the idea okay, maybe it's celiac. I hadn't been tested at that point.
Did that help a little bit? At least reduce the pain a little? Yeah.
A small amount in terms of frequency, but when it did come, it was
still there.
Still bad. It was almost worse because I wasn't used to it constantly. So that tolerance almost is gone. But it was in my first year at Laurier, in March, I think it was, that I had a crap day. I wasn't feeling good. We actually went to the museum that day, the Royal Ontario Museum in Toronto, as I lived in residence during school. So we went with my floor, which was a history floor. We were special. And so we went on a field trip basically. And I didn't feel good all day. And I kind of just kept putting it off, and all of a sudden I was exhausted. I didn't know what was going on. And I went to bed as soon as I got back from the museum, which was at 4 p.m.
Yeah.
And I woke up, I just KO'd, and then woke up at I don't know, 6 a.m. or something like that, in the worst pain I had ever felt in my life. And it was weird because the way it was feeling, I almost thought it was gas pain.
Sure.
And so I got up to get some Gas X from under my sink, and I doubled over. I couldn't stand up straight. And I was like, oh, okay, something's wrong. And so, being the Googler that I am, I was like, I wonder if it's my appendix or something like that.
Sure.
I started pushing, and so I ended up taking a cab to the emergency room. And yeah, right. And I didn't want to pay for an ambulance. You know what? Going to the hospital so much, I'm sure we've all experienced this, you start to doubt yourself. And so I wasn't about to call an ambulance or something like that, or have anybody even know where I was going. I was hiding it. And I was like, I don't want anyone to know because they're just going to think I'm a hypochondriac. And oh, Erika's at the hospital again. So
same. I get it. I've had an Uber on call to go myself. Yeah.
I didn't tell anybody. I got there and they put me in a room. I was on the floor crying in the hospital, which is not the best place to be because it's so germy. But I was literally doubled over crying, and nobody knew I was there. I didn't tell my roommate. Well, we shared a bathroom, but basically she was my roommate. I didn't tell my roommate. I didn't tell the person who was in charge of my floor. I just disappeared for the whole day. I didn't tell my parents. And they admitted me at 3. I talked to a surgeon, did some weird ultrasound stuff. And they were like, yeah, I don't know. This doesn't seem like typical appendicitis. But, you've got some increased blood flow to that area. So we're going to keep you here overnight and reassess you in the morning for possible surgery. Of course, that's what ended up happening. So at that point, because I had to be kept over and I was on birth control at the time, which by the way, did not help me at all. But so I needed that, and I needed, my lip balm, and I wanted headphones. So I did tell my roommate, and they came to see me, but the doctors put me on morphine, for the pain. And that was my first run-in with morphine.
Yeah.
And Gravol and stuff, because I was like, I'm gonna throw up all over the place.
Sure.
And I did end up waking up at 3 a.m. and projectile vomiting onto myself, which was really weird. And I felt really bad for the nurse. But
you're like, I'm sorry.
That's what happened. But so
did you have appendicitis, or did you have a ruptured cyst?
I had endometriosis that was growing on my appendix and finally went deep enough to cause that thing to freak out, is what ended up happening.
Wow.
So he did the surgery in the morning, and I ended up calling my parents.
I was like, please tell me you called your parents.
Yeah. I called my parents in the morning after they said, okay, yeah, you know, all your levels are still kind of weird. Something's going on. You're still in pain. So they gave me more morphine. And then we're like, you're going to have surgery probably at 3 p.m. So I called my parents and I got a hold of my mom and told her. And while I was on the phone with her, apparently something had happened. So they moved me up. The nurse comes back in and says, oh, you're actually going down right now.
And so you had no one there?
With my mom. She was like, what? I didn't even tell them what hospital I was at. They had to Google the hospital.
Oh my gosh.
For Waterloo.
Oh my goodness.
Luckily came out with the right one.
How far away are they from where you were?
It was about an hour.
Okay. So at least they could just like get in a car and get to you.
Well, the funny thing is, I think they finished the workday. and
then came. Oh my goodness.
I asked them. But
well,
yeah.
You were asleep anyway, I'm sure.
Right. Yeah. I didn't see anyone. I just woke up and I was getting wheeled in and they were there.
Yeah.
But yeah, when I talked to the surgeon after, he was like, so it wasn't infected, but we did find some endometriosis. And that was when I was like, can I have kids?
Yeah. Got it. So you're still in the hospital just asking this, like,
yeah. And he wasn't a gynecologist, so he couldn't answer any questions.
Yeah. He was just like a general surgeon.
Yeah.
I'm impressed that they knew it was endo.
Right. He didn't say for sure. He said, I think.
Okay.
It looks like, you know, things like that. So I think he knew what it was and what it looked like, but I think he was kind of trying to cover his own tail by saying, like, you know, because he's not in that field.
Right.
But yeah, so they did remove my appendix, so I'm appendixless, but they did not take out any of the endo around there.
Sure.
And
which is respectable. You wouldn't want that person touching the endo.
Yeah. I was pissed at first because I was like, oh, what the heck?
Yeah.
But now after, you know, knowing kind of you have to have a skill set to do that, I'm fine with it. Nice guy. But like, yeah. So that was like the first time I'd really heard the word in association with myself. And so I started looking it up. And it took me 4 more years to get under the knife again.
Yeah, I was going to say, what year was that? That was
actually about a year ago now, because it was, or a little less than a year ago. So my official diagnosis via surgery was only September.
Okay. Of 2019.
Yeah.
But 4 years before is when you had your appendix episode. Got it.
Yeah. And so I knew that I had endo before then, and I went to see my doctor. I went to see a gynecologist, which took me forever to get in to see a gynecologist.
Right, because you're in Canada.
Yes.
Yeah.
Pros and cons. Pros, you don't have to pay for everything. Cons, it takes forever and we die on waiting lists.
Yeah.
But that, and not all the technology is up to date. Like if I had insurance to cover it and like went into the States and was like, ow, they'd be like test and have me in like these nice ass rooms, whereas here, but like
that's totally allowed.
Okay, cool. I'm gonna try not to, because I have a mouth on me and it just won't stop once I start.
Okay, so tell me though, go back to the appendix. So you get that all done and then you go home and you're like, I have this thing. You start researching. Do you figure out kind of what endo is, or do you just go on with your life and keep pressing forward?
No, I figured out what it was. I wanted to make sure that I knew what it was, because I'd already had all of a sudden these things started making sense, right?
Yeah.
I was like, oh my God, this can cause this and that can cause that. And then even then, like for years on, the next couple of years, like I was still finding out about stuff that is caused more or less by my endo, that I thought it was something else, or was like, oh, there's no way that could be caused by this, but turns out it is.
Yeah.
So like I didn't know or clue in at first that it was bowel endo that I have, until even like September. I had very, very strong suspicions, but only had that confirmed in September. And unfortunately,
right, because you had bowel issues years before.
like it's always been
An issue.
worse.
Yeah.
Really, I don't know that it started off as bowel endo. Oddly, it doesn't seem to be actually growing on anything reproductive. Like it's growing a little bit on my actual uterus, but it's going all over my digestive tract and like the organs in that area rather than my actual reproductive organs.
Interesting.
Not sure if I prefer that.
Right.
On the one hand, I'm pretty free and clear as far as I know right now in terms of being able to get pregnant at some point, unless scar tissue in the area is an issue. But like, as far as I know right now, that's not going to be a problem. But like, I've just been told, you won't know till you try. And my mom was actually diagnosed with PCOS, and when she was younger, and she was actually told not, like she wouldn't be able to have kids. And her and my dad, just kind of threw it all out the window, stopped even trying to, prevent it. And hello, I'm born. I'm the oldest. There's two of us. And then when they went to try for my brother 3.5 years later, apparently it was instantaneous. So there you go, right?
There you go.
Obviously she didn't have, polycystic, because they also went away, apparently. I think she had endo, / has it. Yeah. She doesn't think so. She's like hardcore against it. But I haven't had any abdominal pain and stuff. I'm like,
you can be asymptomatic. Yeah,
So,
I've met a lot of asymptomatic people.
And that's something, to be honest, I think that maybe both my parents as well as like friends and other people who haven't had a brush with this don't fully understand. I don't think they really get that one size doesn't fit all.
Yeah.
Right? So it's like, and it really goes with anything. You can have the exact same thing or experience as someone else, but still experience it differently, right?
100. Every endo story is unique. Again, another reason why I do this podcast. Why would I do the same story for every episode? That's why I do this, because your story, I've never heard anyone that's been diagnosed when they had their appendix out. This will help someone else who may be having appendix issues. Like, it's every endo story is different, and the doctors don't know why. And it's, they don't know enough about endo to understand it.
Yeah.
They're getting closer. So, but I want to go back to, so you go back to school, you had this appendix out. What happens then? Are you still just in a lot of pain and you start taking painkillers?
Yeah. So they gave me a prescription for hydromorphone after my surgery, because
I don't even know what that is.
It's like take home morphine.
Okay.
But I think it might be cut with something else, because it's not like just morphine. Like my dad has really bad kidney stones.
Yeah.
I feel like I'm like totally making it sound like my dad's not a healthy dude. He's not. But like, he's got really bad kidney stones. So he's had prescriptions for actual like pills that are morphine, not high or anything like that. And he doesn't have any issues or anything. But so I know that does exist. So if they're giving me hydromorphone, I think it's different. I feel like I've Googled it at some point, but I can't remember. But yeah, so I started with that. I told them that Percocets make me sick. And when I had my wisdom teeth out in high school, they actually gave me Oxy for that, and that made me sick as well. So I only took, I think, like 2. But with the hydromorphone, it worked, right? And I didn't throw it up. So I got reoccurring prescriptions for that even after the surgery. And you might be shocked to learn how damn easy that was.
To get those.
So easy. Ow, I hurt. Oh, here you go.
Right. Did they put you on birth control as well?
Yeah, so I'd been on birth control since I was 17.
Okay.
Like I went to the doctor and asked for it.
Yeah.
But honestly, as I got older, it did nothing. It helped with some teenage acne, and then obviously as I got older, I was always careful anyways, but it helped the no babies thing.
Sure.
But other than that, I don't find that it helped with my endo at all.
Right. You still had pain. Okay. And so now you're able to get this prescription for this drug that doesn't make you feel sick.
Also, I'm not on birth control anymore. I went off 10 or 11 months ago. And that's one reason why I can confidently say that it did nothing for the pain.
Because you felt the same.
Yeah. So I on like it made me fat. And I've lost a whole bunch of weight now since being off it, much easier. And my skin kind of freaks out down here a little bit now, like on my
That's
jawline.
hormonal. Same.
Yeah. So yeah, I got the hormonal breakouts. But other than that, honestly, I'm way less depressed. So there's that too, right?
Mm-hmm.
It's nuts.
Yeah.
But yeah, like it's crazy for people also, since you mentioned about never having heard anything about people being diagnosed through an appendectomy before. In case there is anyone listening that is having issues like that, know that, like, honestly, push. Don't be mean to anybody, but like push for what you know you're feeling, because with the abdominal pain, they looked at appendicitis for me for probably like over a year and a half. I had a CT scan, I had all this other stuff because they actually couldn't find my appendix. And so they said that based on the sheer fact that they couldn't find it, it couldn't be appendicitis. Because if it was, it would be swollen and they'd be able to see it. So that's one reason why it took so long for them to go in and like cut me open. Because at that point when they did it, I started asking them to do it.
Yeah.
That particular day when they brought it up, I straight up went to the doctor and was like, cut me open. Like, they did it lap, they didn't actually cut me open.
Yeah.
But
right.
But yeah, so like if anyone is kind of going through that sort of thing, be as nice as you can about it without being a pushover, and just like go with your gut, literal gut instinct.
Yeah.
And fight for yourself, because chances are the doctors aren't going to, unfortunately.
Yeah, that's great. That's great advice. And I always say that too, you have to advocate for yourself. Unfortunately, it's just a part of this disease, especially too, because there's so many unknowns. Okay. Well, so you start getting these prescription painkillers and it starts to be easy to take them. Do you start to take them every day? Are they helping with your pain? Does it start to become a problem?
Not every day at first. And honestly, this kind of like silently creeped up on me. And again, it's one of those things I didn't really realize until after, or I clued in later. So I don't like to say I got addicted to painkillers, because I don't see it as an addiction. Dependent, right. Though. I started taking, I had prescriptions for the hydromorphone and Percocets were the two main ones. And like I would go to the hospital. I'd also go to the hospital and end up with a morphine IV, which was way better because
were you in extreme pain when you were going, or was it you kind of got used to taking these pills and they were helping with the pain, but now you were like, I need to go to the next level because the pain's still there?
Honestly, not so much the next level thing. It started to, and so no one actually knew this until recently, and my dad's in the next room over right now, probably semi-listening to what I'm saying, so they know a little bit about this now, and now they do know that I did have a bit of an issue, but not all of it. And so I hit it very, very well, aside from sleeping all the time. But like, so I was in a lot of pain when I went to the emergency rooms at first. Then I would start to go when the pain was bad, or I could feel it kind of starting to ramp up a little bit, but like not emergency room worthy bad. It was more of a, if I go, they'll give me an IV, which I liked more than the pills, because like I said before, like the Percocets, for example, which was the one I got, they prescribed that much easier than hydromorphone. So it was hard on my stomach and I didn't want to puke it up.
Yeah.
So IVs. And to be honest, I got into this place where if I didn't have an IV in my arm at the hospital, I felt like no one took me seriously. For some reason, being in the hospital and having an IV, if you're just, in the hospital and you leave with nothing, people are like, yeah, whatever. But if you're there and you have an IV and it's somehow the universal symbol for, oh my God, something's wrong with you.
Right. Yeah. You felt more like justified because I get it. I get it.
Right. So that was sadly part of it, I think, looking back at it now. But yeah, it was kind of like ow, I hurt and I don't want to deal with this, morphine me up sort of thing, right?
Yeah.
And so that's kind of how it started, I think. And it ended up going into, I tried to spend less time going to the hospital, because then I started feeling, okay, well, now I'm being judged for going to the hospital too much. And instead, there was just so many feelings.
Yeah. Well, look, you got diagnosed with this disease. You probably did a ton of research on it. You've already been through a lot. And now this is a kind of a way to escape it a little bit too, right? You're in pain and it's a little bit of an escape.
So one of the craziest thing, and I will probably go to my grave saying that this is because of my endo, is 2 years ago, I had an infection called C. difficile, which can kill you. And it's more painful than the endo, and the worst experience I've ever had in my life. And I had to be hospitalized for what ended up being like almost a month.
Wow.
During school.
Yeah.
That was 2 years ago. And they put me on morphine for that too.
Was that like a bacterial infection? How do you get that?
Yeah. So the reason I blame it on the endo and how you would normally get it is, apparently, from what I understand, it's a bacteria that can naturally exist inside of your intestines as it is. It's one of the bad ones that goes along with the good ones. And typically in a healthy gut, they balance each other out. And so the bad one doesn't take over and kill you, right? So, but you can also catch it. Apparently it's incredibly infectious. So you can get it from someone who does have a ramp up of that bacteria. But if it does exist in your body and you didn't catch it from someone, the main way to like make everything off balance is antibiotics, because they kill the good flora and leave the bad. Now, I was on a lot of antibiotics over the last few years because I got basically blanket antibiotics all the time, because I would go in with this pain, and I do have some bladder pain kind of that goes along with the endo.
Yeah.
So I'd go in saying, ow, and they say, without doing a test, here's antibiotics because you probably have a UTI.
Of course. Like
yeah.
IBS, UTI are both like, they make me want to freak out. I know.
So I had been on and off antibiotics of various strength for UTIs multiple times. And then I did actually have a real UTI somewhere in there the one time. And so that was legit. And I was like peeing blood.
Sorry for laughing. I'm not like laughing. I'm just laughing because it's like
I'm
inside.
laughing.
Yeah. It's like inside endo, like humor. Only we will get this.
Right. It was crazy. And so that was actually legit. And I needed the antibiotics for that one. But yeah, later, it might've been those antibiotics that kind of tilted me over the edge, because like 6-7 months later, I was in the hospital, like half dead. And I'm not exaggerating when I say that. There was blood everywhere. I was vomiting and blood was coming out of my rear end. And my parents were like, oh my God, what's happening?
You're like, what is wrong with our poor daughter? She's been through all of this stuff. Oh my goodness. Okay. Yeah. So that all happens. How do you get back on this endo journey to have another endo surgery? It sounds like, do you finally say, all right, I can't live like this anymore. I need to talk to an experienced doctor?
Well, I had already talked to a gynecologist about a year before that. So a year after my appendectomy, a year before my C. diff hospitalization, where they gave me the morphine, which didn't help. But but even then, I told them I had endometriosis, and they didn't even consider it to be like a factor or anything like that. And I had while I was there, I got tested for celiac because they wanted to do another colonoscopy on me to check for damage, stuff like that. And they, didn't see anything, which was nice. And then they did the celiac. So that was actually a huge relief, because even though knowing I had the endo at that point, I was still kind of like, could this be a combination of things?
Of course. Yeah.
But yeah, so I had seen a gynecologist about a year before that. You'll laugh at this. She told me to get pregnant.
Of course she did.
I was 21 or 22, I think by then. And I did have a boyfriend, but like,
no,
we're in school and we're young, and no. And so she was like, have a baby, or don't wait too long to have a baby because it might fix you. I was like, no. And then she also told me to start taking my birth control packs back to back and basically skipping
your period. Yeah.
So I did that for a little while, and honestly, that made me feel about 1,000 times worse. So I only did it for 3 months.
Yeah.
And then, plus my insurance was like, no.
Yeah.
They wanted to charge me a whole bunch for it because I couldn't, like, when I went in to go pick up my pills, because I was ahead of schedule that they were on the computer, they were like, no, you can't have these. So it got complicated as well.
Yeah.
But yeah, so she did that, and I asked her about the surgery because I had read up and researched before I went to go see her.
Right. And you were probably like, yeah, having a baby doesn't do anything for this lady. But anyway.
Yeah. She refused to do it. She didn't want to go in and look. She felt that surgery was unnecessary and might create even more scar tissue, which I get that part. But the other part, I was like, woman, I need to know what is going on inside of my body. Right. I never went back to see her, obviously.
Good.
And then it took me another couple years to get another gynecologist. And even that, I got him on a fluke. I went to the emergency room near my house now because of pain. I was like driving and I almost passed out. And which is obviously not great to do when you're driving. And so I went in, and I didn't know this, but the hospital that I was in had a women's center. And so the doctors knew what endo was, took me seriously.
Yeah.
Didn't give me narcotics. They gave me like naproxen or something.
Sure.
And Toradol. And
I love Toradol.
Right? It's like super Advil.
I love it. Wait, before you go there, do you stop taking the narcotics, or are you still taking them
at this point? I'm still taking them at this point.
Okay. Anyway, so you meet this great doctor, Toradol, yay!
Yeah, and they were like, we're going to get you in to see one of the gynecologists here, because if this is this bad, and I basically told them my whole life story.
Yeah.
And she still did a pelvic exam, and let me tell you, the amount of pelvic exams I've had is never comfortable. But
that ultrasound is, you don't know what.
Mind the ultrasound, it's like the
actual exam,
hands and the speculums that I like. I don't do well with speculums.
I don't like the interior ultrasound. I've just had so many. I don't love it. When someone says, when you first have your first one and they're like, oh, you're having a transvaginal ultrasound, I didn't know what that meant until I got there.
I looked it up.
Surprise!
I knew what it meant, but I was like, and then I think I kind of like over analyzed it in my brain and thought it was going to be worse than it was. So I don't mind.
I mean, at this point, we've probably both had hundreds of them. Okay, so you see this new guy who gets endo.
Yeah, and so it was weird. This clinic was like, yeah, we'll get you in to see someone. I thought I was going to be waiting like a month. They called me the next day and scheduled an appointment for the next week.
Awesome.
With a gynecologist. So I went in, saw him. Because of the way everything was booked, it took me about a month and a bit, but that's nothing, right? Like a month and a bit to get in to do the surgery, which was scheduled for September. So we did it. Unfortunately, I didn't ask enough questions. He did ablation, not excision. But he also told me, yes, it's bowel, it's deep. It's not growing through, and I know that from the colonoscopies. But like, it's not growing through, but it's on there, it's deep, and so he actually couldn't touch any of it that was on my bowels. He only cleaned it up on like the connective tissues and organs and stuff like that. Did he
give you a stage? Did he stage you or anything?
Yeah, because it's growing through the tissue, it's technically 4.
Yeah.
That's what he told me.
Yeah.
So, which it explains the contractions.
Yeah, for sure. So that was September. It's only a couple months ago. How are you feeling now?
A lot better in a lot of ways, because when I had that surgery, about a month before that surgery, it's weird having the doctor take me seriously. It came at the same time that my friend told me her doctor had refused to do the surgery, and that had happened to me, right?
Yeah.
So that's when I lost it, and it was like some switch went off in my brain and basically said, I'm, gonna live my life. I'd kind of been hiding from a lot of life up until then, even during school, right? Because I got into this place where I was like, even after I graduate with my degree, what can I feasibly do with my life? Because I don't feel well all the time.
Yeah.
I'm tired. Like, what job's gonna hire me? I went through like this kind of low period in a lot of ways. And then on top of that, I was like popping painkillers that no one knew about. Like literally, even my boyfriend, and I lived with him and 2 other roommates during all like my last 3 years of university, and they had no idea. Even he didn't know. He knew I took them sometimes,
Right.
but not to the extent.
For pain, you were taking them. Yeah.
Well, the thing is that I had actually stopped taking. This is where I start to recognize now that, okay, this is an issue. I started taking them to sleep, and like, that's bad.
Yeah.
You know what I mean? Like,
yeah.
you know, there's at least approaching an issue when you start taking things for other reasons than what they're prescribed for. Like, these were prescribed for pain. Yeah, sure, I was in pain majority of the time, but I was at a point where I was like, oh my God, I want to go to sleep and I can't sleep, or I feel like napping or whatever. Where's my drugs?
Yeah.
And that's kind of like, at that point, you're sort of taking them as an escape, you know. At least that's the way I kind of have looked at it.
Yeah.
And so I was actually still taking them when I saw the doctor, and my friend told me about the thing. And when I lost it and the switch went off, I decided to stop taking them. So I actually stopped taking them. I threw them all out and like didn't go to rehab or anything like that. Like, I stopped taking them cold turkey. So that was really hard. My dad and I actually went on a father-daughter trip to Philly that like this past August. So before my surgery.
Yeah.
But while I was actually coming off of these drugs, and like quite recently. And so we went to a Comic-Con, actually.
Awesome.
Which was great. We'd never been to one, so we were like, yeah, let's go. And I'm a huge fan of Tom Holland, so I'm like, yeah, he's gonna be there, let's go. But then there was also people there from Harry Potter, like the Phelps twins.
Cool.
So I was like, yes, this is my life. But like he commented on that trip that I was super, super mellow. And I'm kind of like that anyways. But he was like, wow, you're like so mellow. What's up? But I guess he also picked up on some really weird behavior while I was there. And I didn't really realize that I was even doing it. But apparently I was being really weird. And so like, oh, that's great. So you're telling me I met Fred and George Weasley and Spider-Man being weird? Great. So I was like, if I ever meet them again, I will
tell them I was being weird.
Yeah, not like they remember me. But like, but yeah, so yeah, I had no idea that I was even doing that. And he apparently came home and was like, Erika's weird. Like, to my mom, and they didn't know. I told them later,
yeah,
a month or two later, that that's what was happening. And some other stuff kind of came to light when I was hospitalized. I maxed out my credit card on Amazon Prime, ordering a whole bunch of stuff, which I don't remember doing.
Because you were
hopped up on the morphine.
Yeah,
and Gravol. But yeah, so, or Dramamine. But yeah, so it was a problem. And yeah, so when I lost it with what my friend told me, and I had kind of been on this little upswing, because I was like, oh my God, someone's finally listening to me, and I'm doing this, and I'm finally going to get a proper diagnosis and know what's going on in my body. The upswing just kind of kept going for me, I guess. And that's when I sort of started to figure things out. When, you know, I lost my mind, decided to put stuff on Instagram. And that was also when I decided to get back into the acting stuff, because I was like, the only reason I ever stopped was out of fear, and that's not a good reason. So
you didn't lose your mind, you found your purpose.
Pretty much, yeah. That's what I like to say. I lost my mind though, because I literally like went into a blind rage and was like yelling on the phone to my friend. Like, oh,
you just got to the point where you like, this is ridiculous, and your mission became to help other people.
I guess so, yeah.
Because you care about that friend so much, you were like, I'm not going to let you suffer through this like I have.
It's funny because that's exactly what I end up saying, especially with kids and stuff like that too. And that's exactly what I end up saying. I'll say, like, I know that within the next 10 years or something like that. And especially with the stage I'm at, and I kind of don't want any more surgery if I don't have to.
Yeah.
But like, so for me, I'm sort of like, I know that I'm probably not going to be able to change things enough to help me, but I'll be damned if another kid especially has to grow up with the pain and the uncertainty and that we all have, 10
I mean,
years ago.
24, you are young, and I have all the faith that you will feel better and you will get through this.
Yeah. Well, I started, quarantine has lulled me a little bit, but I changed my diet like radically in the last, like, it all started from the losing my mind.
Right. Well, you had the losing your mind. I say finding your purpose. But then you had the surgery, and you have a team now of doctors who get you, right?
Yeah. Well, I haven't actually been to see them in a long time, really, since the surgery, which is actually a good thing.
Yeah.
So like, I'm not actually taking any drugs anymore except for like Tylenol. Advil's too hard on my stomach after everything it's been through.
Yes.
But so I'm not taking anything. I still have a naproxen prescription in my bedside table if I really, really need something, but I force myself not to take it most of the time because to me it's a stepping stone.
Yeah.
And I don't really want to go kind of down that rabbit hole again, because I have to say that, for me, the way I view drugs personally, I think I was like teetering right on the edge of the rabbit hole before, and it would have been very, very easy for me to fall in. And so I don't really want to do that again.
That's something you should be really proud of yourself. You recognized it and you solved it. It's a big deal. You should be very proud of yourself.
Thank you. It's funny because like people have, like, some of my friends and my dad sometimes goes like really emotional and hugs me and tells me that. But like,
you've been through a lot.
It's very odd actually, because I've had so many people say that to me, and on the one hand I don't really like reacting and being like, oh, like, thank you and stuff like that, because
it's awkward.
It almost feels weird. It feels like, yeah, I know, because on the one hand I do know, but I'm very into right now trying for myself and to get other people to kind of recognize their own strength and their own power. And I'm trying really hard right now as well to not like cut myself down, because I'm afraid that people are going to think I'm conceited for thinking that way. And let me tell you, it's a whole mind thing. But like, it's really weird. But like, I don't like it that you can't talk yourself up because someone's going to tear you down, and like, you don't talk yourself up because you're afraid that someone's going to think you're conceited or something like that, right? Like, what can I say the F word on here? She said,
yeah.
What am I? Like, honestly.
I mean, do you know who Gary Vaynerchuk is?
I do not.
You should start following him. He's on YouTube. He's on social media. Gary V. So Gary VEE. Just Google it. You will find him. He is like this marketing guy. He's great. He really has helped me to just not care what other people think. And I'm very like empathetic and sensitive. And I've had people make like rude comments, or people even just constantly ask me like, how are you feeling? How are you feeling? How are you feeling? And it's just not the appropriate way to talk to someone that has a chronic illness. But those people are coming from a place of love, right? And then the other people are just jealous of you. I don't think it's conceited if you're telling people your journey. I don't. Like, I need to push myself to do that too, because I fear what people may say to me on social media. But at the end of the day, you're helping other people and you're just telling your story.
Yeah.
You have been through a lot and you have accomplished a lot, and your story might be someone else's survival guide.
That's what I keep telling myself. And that's why I started doing it. I've been almost in a nap for the last month because of everything going on.
Well, yeah.
I've been sick and not really know how I'm feeling about all this, but like that's something that I've kind of tried to do, I guess, is just, be honest about stuff, even if it's difficult. Like I've again laxed on it for the last month, but getting back into it now. I've written articles and stuff like that on Endo, and I have one as well as on like sexual abuse. And even in that one, you know, reading it over afterwards, I'm going to keep it the way it is because that's me talking. But like, I sound like a huge hard ass in so many of my articles because I'm very point of fact, I guess, in the way that I talk a lot.
Yeah.
And I've been told this before, that sometimes it gives people like the illusion that I'm either like a huge bitch or like that I find everything super easy. And that is not the case at all. It's just, I think with all the things that I've been through, I've been like this since I was a kid. So I have to say probably with the sexual abuse stuff, that's what kind of put me down the path. I ended up being hard as nails in a lot of ways.
Right.
Instead of, I guess, like retreating into myself and, you know, crying about it all the time, which does happen. But like, so it sort of feels weird for me in some ways because I know that I'm really, really strong, but I'm very, very afraid to like say that like I just said it right now.
And that's a great post right there. I know I'm strong, but I'm afraid to say it. And then also show vulnerability. Talk about, so you can show your strong side, but then also talk about the days you are in really bad pain, or you are having an emotional day, or your brain is all over the place.
Honestly, I'd love it if someone just like followed me around with a camera.
I know. It'd be so much easier. Wouldn't it be so much easier?
Oh,
I
it
know.
feels so odd posting on social media about some of it because I need to do it and I want to do it, but I'm like, I don't feel good. Therefore, I don't feel like taping myself or taking a picture of my belly and stuff like that, right? So
I get it. I fully get what you're saying. So what's going on with the bowel endo?
I hate it.
What did he say? We're going to refer you to an excision specialist for the bowel, or just watch and wait, or what's your treatment plan for it? Or do you not have one?
Live with it and hope I don't ever need a bowel resection is essentially what's going on right now. Because it's very difficult. I have to try and find a balance between what I want to do to my body. And honestly, I don't really want to get put under that many more times in my life. It's good for you. On top of that, every surgery I have to take something after it. Like the surgery I had in September, I had already started going off the painkillers. I wouldn't let them give me a prescription for anything. They gave me the naproxen and that's it. And he's a good surgeon because I really didn't take anything, to be honest. I think I took one, and I just tried to literally walk it off or lay down and chill. I had a friend come over actually because my parents ditched me a couple days after surgery and went on vacation. So like, thank you, I love you too.
They were like, bye.
But a good friend came over and she stayed with me for a few days. And so it was fun. And honestly, I got through kind of the first week of recovery easier, I think, than some other people maybe have had.
Yeah.
But I didn't take anything and I've kept it that way. And so for me, I'm on a very weird mental path right now because on the one hand, I don't ever want to have a bowel resection. So it's probably smarter for me to get this excised. Is that the right term?
Yes.
Taken out,
yeah.
You know, while I can. But on the other hand, I don't want to go under the knife so soon, but I should. And it's like this weird back and forth argument with myself.
My advice, trust your gut. Like literally, like you even said though, just every time I trust my intuition, it leads me down the right path. You're not ready. You're not ready.
The thing is, I've lost all the weight I gained throughout like school and stuff like that. So I've lost about 25 pounds, give or take, in the last 8 months or so, just mostly from changing my diet.
Sure.
And stuff like that. So that has actually helped a lot in terms of like energy and some other things. Like basically the way I'm looking at it, and this is kind of the route I'm going right now with exercise and diet. I'm not one of those who thinks that it's a cure or anything like that. It does help with, you know,
symptoms.
Yeah, like them reoccurring so frequently, it's helped a bit. But like for me, the way I look at it is even if it doesn't, you know, cure the endo or change things too much, I'm gonna try to make my body healthier and my mind too. But like I don't see anything wrong with trying to be healthier, and you're gonna feel better if you're healthier regardless of if you have a chronic illness, right? You know what I mean? Like my symptoms from the illness haven't changed. But overall, I feel stronger. I feel less sluggish because I don't have like this buildup of fat and toxins and things that aren't supposed to be in my body. And I don't like to come across as like, oh my God, you have to be the skinniest person in the world or something like that. But for me personally, I'm small. Like I'm built small. I always have been. I used to be a twig and not gain any weight at all because my metabolism was super high. So for me to be able to see, you know, my ab muscles and stuff like that is not only a major accomplishment for me, but it's like that's the way I'm supposed to look and that's the way I'm supposed to feel. I'm supposed to be strong. I'm supposed to be, you know, healthy and stuff like that. And so for me, like that's where like body positivity from I guess the small side comes in. And you know, it's good all the way around. But I'm actually going to be working with a couple of people, some new friends, who asked me to be part of their project for body positivity. Hopefully, we'll still be shooting it sometime this summer. So I'm really looking forward to doing that because I think that that's a massive, massive thing with anybody who has endo, regardless of what size or shape or whatever you are. It is a hell of a thing to look one way in the morning and look pregnant by the end of the day.
Yeah.
Like it's like some Twilight
It is. It's
Bella
crazy.
vampire baby thing going on.
It is. Alien. Yeah, I know, for sure. Well, is there anything else you want to add before we wrap up?
No, I think we talked about like my life.
Well, I appreciate it. And I want you to keep an eye on the bowel stuff. Not saying have surgery, but just keep an eye on it.
Yeah, I look out. The main thing that I have to look for is blood. When I see any type of blood, I usually will go.
Or if you just start having extreme nausea or you have a hard time eating or vomiting, just keep an eye on it.
That's one thing that's actually helped with the whole diet thing because everything's moving properly.
Right.
It helps with the bowel endo loads because I still get the contractions sometimes and I can't stand up or sit down.
Yeah.
Or
but
breathe.
When you're constipated, you're in way more pain.
Oh God, yeah. And it's like, it's just unbelievable. And that's, you know, not comfortable for someone who doesn't have bowel endo and not good to have those toxins in your body for someone who doesn't have bowel endo.
Yeah.
But, you know, if you have it, it just makes everything so much more irritated. And so that's one thing. If anybody listening to this has bowel endo, try and keep your colon clear.
Yeah, it's true. No, it's great advice. It's great advice.
Well, enema because that can screw up your.
It's not fun. It's not fun. No, I really appreciate you being so vulnerable and sharing your story. And I can't wait to see you on the big screen one day soon.
Thank you. That'd be cool.
Yeah. How can people follow you? Do you want to plug your Instagram or anything?
Yeah, sure. I have Facebook, but I mean, I don't really use it unless it's like a close friend or a business thing. But I have 2 Instagrams. One of them is my personal one. And that's just my name, Erika Triggs, Erika with a K. So ErikaTriggs. And then my endometriosis one, which is exactly what it sounds like, is just a dedicated one. And that one's just the full word endometriosis. And then Erika.
Okay.
So
awesome. Yeah. Well, good. And then, speaking of Facebook, it's not my favorite platform either, but I have started a Facebook group for everybody who's listening and or watching, just for people who listen and or watch the podcast on YouTube. Okay. You can find it on Facebook, and it's just the Cycle Podcast, group or community. Now I can't even remember what I named it, but I just started it last week. So we can discuss things after the show. People may have further questions after they listen, and it's just a community where we can all help each other. So Erika, thank you again for your time and being on. We really appreciate your vulnerability and your strength and sharing your story.
Thank you. And thank you for having me on. I've wanted to do something like this for a really long time. So
awesome. This is great. Thank you.